Hi, everyone, and welcome to this episode of Healing Tomorrow. And on Healing Tomorrow, we look at ways that the healing professions can help our patients and our own profession to be more effective in healing and how we can heal tomorrow that we're all facing, what we can all do to make it a better tomorrow for all of us. The leaders of the health professions are certainly on the front edge of that campaign to make a healthier tomorrow for us. And boy, do we have one of the all-stars in that crew today. Dr. Monisha Bhanote with us, and she is just absolutely remarkable for nothing else than her credentials. As one who grew up in the hospital system, when I was a medical student, the frontline family doctors and GPs were the initial treaters of disease, dealing with the common modalities. But when something strange or mysterious came by, a little non-understandable, well, you reached for one of your more knowledgeable colleagues. And in the hospital, that next echelon up, basically the specialists in internal medicine and the academic surgeons from time to time. And usually the internists were really smart. They are tuned into a whole different set of books and journals. And so the internists really were the academics that we'd go for. But if the academics didn't know, if the internists were not aware of the ultimate answer, then we all knew that the people who would be the most knowledgeable would be those people we seldom see. They're usually downstairs in the pathology department. It's the pathologists who have the ultimate knowledge of disease. Actually, they spend their time understanding disease on a cellular level but also they have the final assessment of the patient. If the patient does not survive, their patient remains on the autopsy table, and the pathologist can divine the ultimate cause of the patient demise. I gained respect for the process when I thought carefully about the word autopsy. You know, you see it on TV, but no, when you think about the word, it's an autopsy. Auto means yourself. Opsy, optical, means to see. An autopsy means to go downstairs and see for yourself. It makes you the ultimate seeker of truth, and that's who the pathologists are. And of course, they understand it on the cellular level and on the organ level. And so, of course, we have great respect for their academic prowess. But as I said, usually they're down in the pathology department. You don't really see them out in the public. Well, we're going to interview today a pathologist who said, this is too important knowledge to keep for ourselves down in the pathology department. There's so much information that the public would benefit from. All these changes that happened before in the patient's body, we need to get that out to the general public. And so Dr. Monisha Bhanote has become an integrative pathologist. Never heard those two words put together. But again, it's a pathologist who is taking all this information and sharing it with her patients. She is quintuple board certified in various medical specialties, and she's a wonderful person. She has remarkable insights into the body as well and into nutrition, a strong interest of mine. So, with that preface, I would like to give a warm Healing Tomorrow welcome to Dr. Manisha Bhanote. Thank you so much for joining us today.
Thank you so much for having me, Dr. Klaper. I'm looking forward to this conversation and sharing with your community a few things that they might not have heard of, even a little more on pathology. So, yes, many people, when they think of pathology, they might think of like NCIS or, the latest TV show. In the reality, most pathology work is done on live humans. So, imagine anything being taken out of the human body, whether you're going to get blood work done at a laboratory, whether you are going for your colonoscopy and they take out tissue pieces for polyps, or you're going for a mammogram and you have to get a breast biopsy or say, for example, you might have ascites fluid and you need to get that fluid out, or you have a thyroid nodule and you need to get a fine needle aspiration. All those people are alive. And that's what a pathologist does is they are examining the tissue on a microscopic level to see what are these subtle changes that happen, because guess what? Disease does not happen overnight. So since disease isn't happening overnight, there's a pathologic process that progresses over time based off of what? A combination of our lifestyle, our environment, our behavior, all of these things. And when people say to me, "My family member has this disease and I'm going to get it," I'm like, no, 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 no. That's not the way the human body actually works. And when we think of longevity in this perspective of how we age and how can we age better, if we understand the human body and what are all the different things influencing it, which nutrition is a huge part of it, we can actually prevent disease.
Well said. And to the viewers, as Dr. Bhanote and I discuss some of these topics, and you see that what a wonderful person she is and what a knowledgeable physician she is, you may say, I want to learn more from her and about her. Well, I invite you to go to her website, drbanote.com, and she's written a wonderful book called The Anatomy of Well-Being. So you can get her book. Yeah, right. Here it
There
is.
you go. Well, I have two books. So I have The Anatomy of Well-Being is really meant for everybody, including lay people, to really understand how the human body works on a cellular level, and then how to, it's a kind of like I joke, I'm like, I'm putting you through med school on your body in one book. So then you know why you need to eat this way, or why you need to move your body this way, or why you need to optimize your sleep. But I do know that you teach medical students, and I must mention I have another book for medical students, which is pathology case reports. So that one is really for medical students who are training and for their exams to understand pathology from a clinical vignette perspective. Because as a physician, I realize that there are so many clinicians out there who just did not learn the basics of pathology. And it amazes me when I'll have a surgeon call me up on the phone and be like, can you tell me if that's benign or malignant? And I'll say, well, you really shouldn't be taking anything out of the human body if you don't know what the choices are to come back. So I'm always looking at how can I educate people, whether they are clinicians or my patients, because the human body or the anatomy of the human body is absolutely fascinating.
Well, I'm so glad that you've produced that book for the medical students. We'll touch on that in a few minutes. And finally, to the viewers, if you go to Dr. Benoit's website for free, you can download her Cell Care Plate collection of recipes. Oh my, and wonderful color pictures. These look like fabulous recipes. I got hungry just going through them. And I was glad to see 100% plant-based. Yay, which says a lot about her viewing of healthy nutrition. Um, I notice that you're not shy about using some olive oil or some coconut milk, and people say, "Ooh, there's fat in those things." You don't seem to shy away from that. You feel that fats have a valid place in the human diet and in your recipes there?
I do. I think, when it comes to nutrition and a person's diet, I think it's very personalized and individual based, and what health conditions they may be going through. Everything is really done in moderation. So sometimes when people think, oh, olive oil is good for me, they tend to overdo it, right? So I think everything is in moderation and personalized. And from an Ayurvedic perspective, which is a 5,000-year-old whole body healing system, which I incorporate into my practice, using oils has really been more of a lubrication for individuals, like lubricating the inside of the body. So whether you're using it topically, to put it on, or if you're using it in your cooking, but everything with moderation for sure.
You have a very strong belief that the food we eat influences our gut microbiota. People confuse those terms, by the way. The microbiota are the organisms, the bacteria and the viruses and the microorganisms that live in our gut. Their DNA, their genetic makeup, all together as a group, that is the microbiome that we get so much information of. And of course, the food we eat determines the makeup of the microbiome. I often compare our daily food stream to the conductor in a symphony orchestra. The same, if you eat a lot of sugar, you're going to summon up sugar-eating organisms. If you eat a lot of meat and eggs, you're going to summon up choline and carnitine eating organisms. But if you eat a whole food, plant-based food stream with lots of resistant starches and fiber, you're going to summon up the more benevolent or benign microbes in the gut. Food is really, really important on a daily basis. But you make a very strong case with the gut microbiome, biota, and autoimmune disease and that axis. Could you tell us more about that, of all the conditions that are influenced, why you focused on autoimmune diseases?
Yes, absolutely. So I like to consider food more than fuel in general. It's information. Okay. So the food we eat is sending information that communicates with our gut microbiome and will thereby influence, well, since we're talking about autoimmune disease, immune system. About 70% of our immune system lives in the gut, which most people don't even think about, right? So if you have an unhealthy gut from eating the standard American ultra processed diet, high in fats and animal proteins, preservatives, food additives, all these things that our body doesn't know what to do with and doesn't know how to properly break down, it affects the status of your microbiome. So in multiple ways. One, it affects the actual bugs that are there, right? So the microbiota, the organisms, the bacteria, the yeast, the fungi, all of that live there, it's going to influence that. Okay. Those microbiota, people don't realize, are responsible for making our neurotransmitters, making our hormones, contributing to our vitamins, breaking down food. They influence literally everything in the body. So every disease essentially you can trace back to beginning in the gut in a way. So if your gut is not healthy, it's going to be very hard to heal from it. Now, autoimmune disease is basically your body producing an inflammatory response to attack itself in a way. And I see this often with, let me give you an example of a common autoimmune disease. The example I want to give you is autoimmune thyroiditis. So thyroid disease, which is very, very common, much more common, I would say, in women. And women might go to the doctor, and the doctor's like, oh, your thyroid hormones are off. You have TPO antibodies, you have certain antibodies that are being produced to fight this process, and you have hypothyroidism. And they're given their medication and they're sent away, and they are put on this medication basically for the rest of their lifetime without having the discussion of, is my body attacking itself? Is there something actually going on the microscopic level? And I can tell you from the perspective of both an integrative physician and a pathologist, one of my board certifications is in cytopathology, which is really looking at single individual cells for disease. So what we used to do was if a woman had, or actually a patient had a thyroid nodule, we would go and put a little needle in it and take a little aspiration of just a little bit of tissue and put it on our glass slides and stain it beautifully with, a Diff Quick and a Pap stain. And so we can see the different features in it. And from there, we could identify, does this person have a nodular goiter? Does this person have Hashimoto's? And Hashimoto's would show us that it would be an infiltration of these lymphocytes. Lymphocytes are one type of white blood cell that go to fight inflammation in the body. And we would see these surrounding it, right? So then the person would, on a fine needle aspiration, essentially they can get a diagnosis of Hashimoto's. But what happens, and this is where there's that kind of, all right, we need to look at the person as a whole. The person, I have seen patients come to me and be like, oh yeah, I'm better because my symptoms have resolved. But the process inside the body continues to go on if they haven't changed their lifestyle. And one of those factors is what's going on in the gut microbiome. And when I'm having patients work with me and we see what's going on inside their microbiome, they have malabsorption, meaning they can't break down the food that they're eating. So, unbroken down food, even healthy food, can be inflammatory to the body. They have an imbalance between the good gut bacteria and the bad gut bacteria because of their diet. They might have instance of lack of short chain fatty acids, which are our post metabolites. So we have prebiotics, probiotics, and we have postbiotics. Well, those are the short chain fatty acids. And we love to have those because they keep inflammation down in the body. How do we make those? From eating more plants. Right. So when I have patients and I'm examining this, I see that they have absolutely no short chain fatty acids. And I'm like, oh, so when's the last time you actually had a salad or you had some greens or some veggies? When I have patients thinking about it, it is not often enough. It should be my last meal had veggies on it, right? So, so these are all factors that, and can see, whether the patient is making IgA antibodies, which is the main antibody that is produced when the GI tract lining is trying to fight harder. And so there's multiple factors that kind of go into it, but I have seen that just by addressing lifestyle with diet, with nutrition, optimizing and repairing the gut, that we can reverse autoimmune disease, which is amazing to me. And that's why I know that all disease and especially autoimmune disease starts in the gut. And I would love patients to have the opportunity to experience that before they just succumb to a lifetime of medications. Because, yes, sometimes if your thyroid is completely replaced by lymphocytes and there's no thyroid colloid nodules, there's no colloid follicles left, then it might be too late. But when we're talking about early in disease, which is when I'm seeing my patients, there is a chance to prevent it from going further. So your body can naturally continue to make this hormone that kind of got pushed out from it. Like I said, I see this often. One of the biggest culprits that I see is diet soda. Oh my goodness. People love their diet soda, and the autoimmunity that develops from the aspartame inside that for that is absolutely like I had one patient, she was a patient who her internist wanted to diagnose her with lupus and thyroiditis, autoimmune thyroiditis at the same time. She was on a wait list to get into Mayo for 6 months. She found me in the meantime, and I said, "All right, let's get to work. Let's do all the testing. Let's see what's going on." And her diet soda habit, which that was what was influencing her autoimmune so bad that once we were able to repair her gut lining, remove the culprits, by the time she got to that appointment 6 months later, guess what? She didn't have autoimmune disease anymore. Her rheumatologist said, no. So I don't think people realize how much nutrition impacts the way their body works. And that's why, yes, I could sit in my nice little office with my microscope and just do my work, but I think that would be a disservice to what I can share about how the human body works, which is why I'm speaking to you.
Wow, that's wonderful. I've always wanted to talk to a pathologist about this phenomenon. Um, Folks, if you are in medical school or you take a course in histology, which is normal tissue, and you look at the thyroid tissue under the microscope, and it's beautiful. The architecture is just exquisite. You've got these lovely hexagonal lacunae, these structures of cells that contain the thyroid globulins and thyroid hormones. They're pristine. There's a little lining of these cells, almost like beads around the edge of the lacuna. It's lovely. And this is normal thyroid tissue. But once this phenomenon of thyroiditis happens, it's called Hashimoto's, but the actual official medical name is acute lymphocytic thyroiditis. And you look at it on the microscope and you're looking, it's like a beehive, it's like an ant colony just filled with lymphocytes. You're looking at a battle going on. You can almost feel the heat coming off the microscope slide. And I'd like to ask a pathologist, what triggered this? What brought all those lymphocytes to invade this normal tissue? What broke down that barrier that that called the lymphocytes in? And so if you could drill down a little bit for me, well, why did that happen? How did that happen?
Yes. So if we think about this autoimmune process from a inflammation, anytime that there is inflammation, inflammatory cells go to that site, right? So in the case of a thyroid, when we have inflammation, the lymphocytes go and they invade and they go in between the follicles. And in fact, what they even do is they replace the follicles altogether. So a nice butterfly shaped thyroid gland that's full of colloid has a different look and feel to it versus a thyroid that all the colloid follicles have been wiped out and it's been replaced by lymphocytes, because at the end of the day all tissue has a both a gross appearance and a microscopic appearance. And I've been doing this so long that I can actually identify without it going under the microscope. All right, this is going to be this type of thyroid, or this is what we're going to expect here. That kind of happens in almost all the tissues, is like the appearance of what a normal healthy tissue in gross pathology and in histology will look like versus abnormal. But the breakdown is happening at this more cellular level, deeper down. And I truly believe it's starting in the gut, where the gut, then you might have this imbalance in your microbiome. You have whether that's microorganisms, whether that's food additives, all these things kind of entering through the gut, because the gut lining is not tight. Like I like to say, like my soldiers showed up for work today and they're all shoulder to shoulder, and the enterocytes, the GI tract lining cells, instead they were partying over July 4th and they're allowing all these intruders to enter. And when those intruders enter, they create an inflammatory response. That response releases inflammatory cytokines. And those cytokines like to travel to our blood vessels to other areas and parts of the body. One of the most susceptible organs for people is their hormonal organs. Okay, so thyroid is a super susceptible gland because first of all, there's no specific nice capsule surrounding it. It's kind of just like it's overlying and sitting on top of your the front of your throat there. There isn't like this like big barrier like we have a blood-brain barrier to get through. So it's very easy to go there. And this inflammatory response is it's a systemic response. It might feel localized because we've been able to identify that, all right, we have these symptoms that are associated with this gland, but it's really a systemic problem.
Wow. So other endocrine glands are susceptible to the same phenomenon, your adrenal glands and the ovaries, and if
And also salivary glands. So we've got our salivary glands, if you think of parotid gland. So it's a very similar process when we get inflammation heading that way. And then with parotid gland, you can get parotiditis and you have inflammation there, and you might get like a blockage with a stone. So yes, it's I would say our glands are our breast tissue, right? So breast glands, you can get mastitis. So there's no, like, I would say, wall up per se. Our body isn't necessarily compartmentalized where everything kind of just stays separately. Everything's flowing through our blood.
wow, well, thank you for
So
that.
you can either flow like inflammatory compounds and metabolites with inflammatory cells, white blood cells, lymphocytes, or you can flow nutrients via your red blood cells to your tissues, and that's going to depend a lot on your lifestyle.
Viewers, if you're interested, I'm certainly interested, but I've got medical problem XYZ. Boy, I'd love to talk to her about this. Dr. Bhanote is reachable through her website. You can do consultations with her and become one of her patients. So again, I invite you to go to drbhanote.com and you can learn how you can take advantage of her wonderful clinical insights. You order blood testing when it's indicated and urine testing and all sorts of
I do.
testing.
I do a full gamut of testing. I definitely do more advanced testing than you would do at a GP's office because I'm looking at vitamin and mineral and nutritional deficiencies. I'm looking at heavy metal toxicity, which me being in Florida, you can imagine the number of patients I have with mercury toxicity. And I mean, the number of examples I can give you with like so-called diagnoses made, and then we actually look at what's going on inside the body and fix that, those symptoms not only disappear, but the diagnosis can disappear. Another example I want to give you, which I think this is a really common one, is reflux disease. And I want to give you reflux disease from a pathological standpoint because I don't think many people understand this. And I think it's very important to know is that so when people are experiencing reflux disease, symptomology wise, they're going to experience it. They're going to get that little acid reflux, that burn after they eat, and then they'll go to their doctor and they'll be given like a proton pump inhibitor or they'll take some Tums, all of this. This is a sign to listen to your body. Okay. Anytime you have a symptom, I always say your body is basically communicating with you, and it's up to you to decide to listen. But I'm going to highly recommend you listen because these are your cells talking to you. And I love talking about cells and how we take care of ourselves. But what is happening there is we have our esophagus, which is a nice tubular structure. It's lined by squamous epithelium, and the purpose of the esophagus is really peristalsis, to move food from your mouth down into your stomach. At the esophagus, right at the base of that, you have the gastroesophageal junction, okay? And then you have the gastric or the stomach, right? So just at that junction, there is a specific lining that the stomach lining is usually columnar. It has specific gastric cells, and then you have the squamous. What happens in your reflux is the stomach acids go up, and they keep going up day after day, depending on if, say, you're eating really oily, fried foods or a lot of caffeine, a lot of chocolate, a lot of processed foods. And this acid keeps going up, and you can make it worse by after you eat you lie down instead of going for a nice 10-minute walk. You just make it worse, right? Because now it's just giving it an easier way. People don't realize that that squamous lining can change, and this is what happens when we have years, and not even years, it could be like 6 months, it could be a year, where the body is so intelligent that it goes, you know what, guys, we cannot stay squamous cells. We have to figure out how to survive here. So, what do? They become metaplastic, and that means that they're going to change into something. And what they change into is goblet cells. They change into intestinal metaplasia because that's what I'm saying. The body is so smart, it knows what to do. It's like, all right, this insult of this acid is going to keep coming. So I'm just going to change who I am. I'm going to change the cell that I am. And it turns into goblet cells to protect itself, basically. Well, if that insult does not stop, those goblet or intestinal metaplasia cells eventually turn into something we call dysplasia. Dysplasia is precancerous. Okay. So, and there's a progression there that happens. It goes from low grade dysplasia to then high grade dysplasia. And that progression is happening on the cellular level where we're getting morphologic changes. And the patient is probably going, oh, well, my doctor keeps telling me to come for an upper endoscopy every 6 months. And then he keeps giving me this medication and it's fine. But no, it's not fine because there's a process that's happening there. They're taking biopsies and they're watching for something like dysplasia to appear. If that dysplasia is not caught early, the next step after high grade dysplasia is adenocarcinoma, which is cancer. Okay. And now imagine this person thinks, oh, my symptoms have gone away. I'm on my medication, I'm doing what I'm supposed to do, but they haven't changed their lifestyle. They haven't changed what they're eating, right? They haven't changed how they move and take care of their body. Now they're dealing with this diagnosis, which could be preventable. And keep in mind that sometimes medications are absolutely necessary. But long term medication, I feel, should always be questioned if the person has not been given the education to address their lifestyle. And I think that's a really important aspect is that many people don't know that there's this 80%, you know, preponderance of what they're doing every single day, 24 hours in a day, that's influencing these diseases on their body. And then also the long-term consequences that we see with people who are on proton pump inhibitors, which generally should only be on for a matter of a few weeks, is in women, I see osteoporosis, so bone loss, right? We're seeing cardiac problems, we're seeing kidney problems. So long-term use is not necessarily the solution when the solution really comes from a lifestyle. It comes from a whole foods plant-based diet. It comes from moving the body because the body was meant to be moved. It comes from optimizing your sleep and so many other lifestyle factors.
Everything's connected in the body, and someone said in the body, any complex natural system, you can't do one thing. Oh, we're just going to turn your acid off for a few weeks. That's what you think you're doing, doctor and patient, but you set off a cascade of consequences every time you change something in the body, and that's why eating the food we're designed to eat, it still comes back to those basics of a healthy whole food plant-based diet. To help someone achieve that, I understand that you are a proponent of health coaches as part of the treatment care team. Tell us how you utilize health coach. What's the role of the health coach, and can people become health coaches? Tell us about your viewing of health coach on the treatment team.
Yeah, absolutely. So remember when we were like in school, like whether that was middle school or high school, we had a coach that might have helped us on the track team or the tennis team. I'm a tennis player, right? So somebody who helped us every week and showed up and, told us what to do and reminded us of like okay, here's the technique here and do this. Well, I put health coaches, especially in that perspective of, okay, your doctor might have guided you on, yes, you need to have a whole food plant-based diet. We need to have this many fruits and vegetables a day, this many whole grains, this many legumes, all of this. But a health coach can be kind of your check-in friend, especially if you don't have somebody who's on this. I have a lot of family members who it's like, oh, my husband won't do that. So maybe only one person in the household is on that pattern. And just somebody really to support you. So I find that health coaches can be very valuable in that sense because we all need support when we're on our health journey.
So, where does a person find a health coach? Or if you're telling them you ought to eat plant-based and they say, I don't know anything about it, who can help me here? How can they find a health coach?
Yeah, so it depends. Sometimes some of the doctor's offices will have their own health coach available. You can also, there's a number of organizations that have trained health coaches. So I'm part of the Physicians Committee for Responsible Medicine, and I know there's a list of health coaches in there. I'm also an alumni of the Andrew Weil Center for Integrative Medicine, and they have their own health coaches in there. So there's plenty of listings that you can go to find the right health coach for you.
And the good news in this interconnected internet everywhere 21st century we're living in, the health coach does not need to live down the block from you or even in your same city. You can check in with them and they just show them what you've been eating, and they can give you some very, very valuable feedback.
Actually, the doctor doesn't even have to live in the same area as you anymore because I'm at all 100% telehealth. So I do everything virtually with my patients, and it's really effective because, I'll go pull something out of my kitchen, out of my refrigerator, and be like, okay, we're going to start with, we need to incorporate this food, and you haven't ever eaten it before. Let's do it like this. Or, Same thing. They might pick up something and then not be sure if it's healthy or not. Especially when you go plant-based, it's easy to get into the trap of the ultra processed food and plant-based too, because that's not the way we go whole foods plant-based. Is we don't replace, our meat burgers with these Beyond burgers. That's not the equivalent solution, right? So being and talking to people virtually with my patients really allows me to kind of help them fine tune this lifestyle that we're living, because they're in their home. They're, I actually do office hours with my community where I'll be in my kitchen and we'll be cooking recipes, and I'll be showing them how to make a quick, like, 4 lentil soup, or I'll be showing them my spice drawer, so they can start building up on these things.
Oh, that's great. You got to really bring it to life. Speaking of which, I understand that you are planning a retreat.
Yes, so I do a couple of retreats a year, and our next one is going to be in the Azores, which are these beautiful islands off the coast of Portugal. They're surprisingly really easy to get to. I think it's like a 5 hour direct flight from New York and from Boston. But they're known as the Hawaii of the Atlantic Ocean because they're just these like untouched islands, majestic, really clean air, clean nature, and we're going to be doing one of my favorite activities, which is forest bathing. Really, and no, we're not going naked into the forest. We're going to go absorb the benefits of the forest and of nature and really get in touch with that. And we're going to do some meditation. And I think sometimes stepping out of our routines that we have in our regular life and in a place where we can actually tune into the quietness of our body and what our body needs, and to be nourished by all my retreats are whole foods plant-based, to be nourished and feel what our body feels like to feel healthy, because I think people forget that. And I remember almost all my retreats, like, when we're like walking and doing stuff, I'm always hearing people like, oh my God, that was the best night of sleep I ever had, or that was the best bowel movement I ever had. Yes, we talk about bowel movements. I don't think people realize what it feels to feel good anymore because we're so stuck in our like, oh, this is normal, like bloating is normal, headaches are normal. No, these are not normal. These are signals from your cells communicating with you. Now you need to learn how to interpret them.
My understanding this particular retreat in October in the Azores is for people of the female persuasion only.
Yes, I'm sorry, Dr. Clapper, you cannot join me on this one. I know you wanted to go, but this particular one is, we do have a co-ed one, but this next one is a women's only one. Yes.
Got it. And if people would like to find out about this, go to drbenote.com and you can see how you can sign up for her retreat. Dr. Bhanote, for the last few years, through our nonprofit initiative, Moving Medicine Forward, I've been going to the nation's medical schools, trying to reach the medical students with some very important messages, namely one, that the chronic diseases that most of these young physicians and physicians to be, no matter what specialty they go into, from family practice, internal medicine, emergency medicine, anesthesia, it doesn't matter. When they open the door of their waiting room, who's waiting there to see them? Mr. and Mrs. America, overweight, hypertensive, diabetic, clogged up and inflamed, suffering from these classic diseases of atherosclerosis and diabetes. And most young physicians are taught the best you can do is control their symptoms, pound down those blood pressures with medications, control those blood sugars with insulin, and hope they don't have their stroke when you're on call. There's just disease management, and that's the best Western medicine can do at this time. Well, healing tomorrow, we got to healing tomorrow, and we can do much better than that. And the first part of the message that I want to get to the students is that one, these are reversible diseases. I wish someone had told me in medical school that most hypertension is reversible, that most cases type 2 diabetes is reversible, most autoimmune diseases are reversible. These are not lifetime curses that you can only manage. These reversible diseases. And that alone should be exciting and liberating to their young medical minds. But also, it's the food that they're eating by and large. That's why they're sitting in front of you, doctor, in these overweight, hypertensive, diabetic, clogged up bodies. And a diet of whole plant foods run through that body meal after meal, day after day, month after month, will do this remarkable transformation. And you see them get leaner and healthier, and their bowels start moving, and their arteries dilate, and their blood pressure comes down, and their insulin receptors open up, and they turn back into normal, healthy people right before your eyes. And you help them regain the gift of health is the most priceless possession any of us can obtain. So that's the message I've been trying to deliver to the medical students. So I will invite you as a co-attending physician to come up to the microphone here. If you had all the medical students in America or around the world sitting in the audience waiting to hear words of wisdom from an integrative pathologist, what would you tell the medical students? What's the most important message you can impart to them on this day?
Okay, wow, no pressure there. Okay, so if I was sitting and speaking to all the medical students across the world, I think the message I would want to imply to them would be that we're entering a new era of medicine. So, one where health is no longer something we can outsource. And what I mean by outsource is rely on medications, rely on that, but it's something we practice. And the way that you are going to be the best physician that you can be and really help your patients is look at the way you live your life. How are you living well now? What are you fueling your body with? Please do not fuel your body with the doctor's lounge food if it doesn't include fruits and vegetables and salad. I mean, the number of doctor's lounge meals that I've had and seen, it's insanity to me. So think about this is to be the best physician that you're going to be out there, you need to be the doctor that the patient wants to look up to and replicate, like, oh, my doctor is doing this, so I know it must be good, right? So how you eat, how you move, how you breathe, how you feel, how you communicate, all of that, because this is not just about preventing disease. This is about building this internal landscape that allows you to live with your purpose, why you wanted to become a doctor, and really shine in that way. So I think the message is we are really at the part where it's a new era of medicine, and our doctors need to be showing up as not just speaking the talk and being the health advocate, but actually being healthy themselves.
Set the example and be that shining light that your patients can look up to and say, yes, that's health. That's what I want to be.
And just to put a little tap on my shoulder, I will say that my biologic age is about 12 years younger than my chronologic age. So I am doing what I'm telling patients to do.
Wonderful. That's great. Well, Dr. Manisha Bhanote, this has just been a very enlightening and enjoyable conversation and exciting. You're really giving us an insight into what healing tomorrow could really look like and the practitioners that are out there helping that new age to come into reality here. So again, if people want to contact you at drbanote.com, and she's got all these wonderful resources, books and videos and retreats. I hope you take advantage of it. And I want to give a big Healing Tomorrow thank you for your time and your insights and your good work. I wish you all the success in the world. Thank you so much.
Thank you so much, Dr. Clapper.